Good morning, good afternoon. Thank you so much for watching and thank you so much for subscribing. Today we are going to talk about one of the contents of the periodontium. Remember, it contains the cementum, it contains the alveolar bone, it contains the periodontal ligament, and lastly, gingiva. So the gingiva is the gum and what we are going to talk about. So what is this gum? Gum as a part of soft tissue lining the mouth. It surrounds the teeth and provides a seal on the teeth. Therefore, what makes the collar of the teeth, what covers the teeth is what we call what? The gum. It is adapted to mastication. Remember I talked about the teeth, they are used for mastication or chewing. So if you talk about mastication, it means somehow as the teeth are grinding food, somehow the hard particles, they can a bit reach the soft tissue. And when they reach the soft tissue, they kind of press some force on the what? On the gum. Because of that, it would have been injured, but it is adapted to mastication or the forces that happen when someone is chewing. We are saying it extends from the dentino-enamel junction up to the alveolar mucosa. The alveolar mucosa, this is the soft tissue that covers the alveolar bone. Remember, we said the alveolar bone, it is the soft bone that where the tooth is what? Is seated, or the tooth is anchored. So, what are the characteristics of the gum? Usually, when we talk about the gum, you shall often get questions asking you what are the characteristics of a healthy gingiva. Sometimes someone can trick you and ask you what is a characteristic of unhealthy gingiva. So we are going to look at these characteristics, which will always be standard for individuals. Number one, color. We are saying color is coral pink. Coral pink, depending on the amount of blood vessels in that place, depending on the thickness, depending on the pigmentation. Remember the pigmentation, some individuals may be having more pigmentation and therefore it may be maybe black, a black pigment, a black gingiva. Some may be pink. So you would like it to get some other individuals, in a normal individual, a dark gingiva, depending on the race. We have also keratinization. This is the first characteristic. Characteristic number two is the consistency. Consistency, the gum, a normal gingiva is firm and resilient. Firm, you're not supposed it's supposed to be firmly attached on the what? On the tooth, firm and resilient. The contour, how this is scalloped. This is scalloped. When you look at it, it is scalloped. Yes. What of the surface? Orange peel appearance. Orange peel appearance. The peeling of an orange. Why does that mean? It is stippled. The stippling is like that one of what? Of an orange peel. This is very important. However, in some instances, we may find this not so much. The stippling, it may not be so much in infants. Even in the interdental gingiva, it may also be less. But we can generally say that the gum or the gingiva has a strip, is stippled. Then lastly, which is healthy, we are saying in a normal gingiva, we are not supposed to be having what? Bleeding. When you touch on it, you're not supposed to be having what? Bleeding. As simple as that. I hope they'll be very easy for you to memorize. If they say outline the characteristics of a healthy gingiva, of the gingiva, you say it is coral pink in color. It is firm and resilient. It is scalloped. It has an orange peel appearance, and it doesn't bleed on a slight touch. Thank you. Let's go to another one. So we did introduction, the contents, we talked about the gross appearance, the characteristics. So we need now to go to the types. Yes. Yes, the types. The types, we have these types. We have a free gingiva. This gingiva, this is also called a marginal gingiva, or you can say an attached gingiva. This gingiva is a gingiva which makes, if we have a tooth, this is the one. If I draw maybe a gross appearance of this tooth, and this is the free gingiva. When you touch on the tooth and maybe you try to separate the tooth from the tooth, the gum from the tooth surface, the one which is free, this is the what? The free gingiva. The free gingiva is V-shaped. The free gingiva, its depth, we can say 2 millimeters, but the average is at least 2 to 3 millimeters. How do we measure this? We measure this from here to here, from where it is up to here. It makes a V, and this V here is called a gingival crevice. You can call it a sulcus. This is very important. From here to here, this is the gingival sulcus. The gingival sulcus is made up of a gingival salicular fluid, which is very important. This sulcus has to be maximum or averagely between 2 to 3 millimeters. How do we measure this? We measure this using what you call a periodontal probe. A periodontal probe is an instrument which is calibrated. Maybe there are different types, but this is maybe from 1, 2, 3, 4, 5, 6 millimeters. It means that averagely, when you put a periodontal probe from here and around the tooth, it is not supposed to exceed 3 millimeters. Because if it exceeds 3 millimeters, it means it is going to be diseased, and a diseased gingival crevice or gingival sulcus, we call it a pocket. So on this one, you're likely to get questions that what is the depth of a normal gingival crevice? This is 2 to 3 millimeters. What do we measure? What do we use to measure here? The depth of the gingival crevice. It is going to be called what? A perio. A perio. Perio means around. Periodontal probe. periodontal probe is the normal probe, but what is what? Calibrated. In order, the moment you put it here, it will tell you that, of course, there has to be blunt here, so that it doesn't traumatize the gum, and has to measure from here up to here. So we need to know that from here up to here in the depth. That's why the periodontal probe is calibrated. We shall look at another probe when we talk which is used to measure or to detect cavities, called a dental probe. But this is a periodontal probe used in the gingiva what? Crevice. So we say this is a free gingiva. It embraces the tooth, and it forms a gingival crevice which is V-shaped, and the depth we are saying is between 2 to 3 millimeters, and the content is what? Gingival clavicula fluid. What is the importance of gingival clavicula fluid? The gingival clavicula fluid is the fluid which is always in this area, the gingival sulcus, between the free gingiva or the marginal gingiva or the attached gingiva and the tooth, or the enamel of the tooth. So what is the importance of this? The importance of this fluid is one, to do clearance of materials in this area. Clearance of materials in this area, to cleanse any material or anything which may be in this area away. Also, it has some antibacterial activities, has some antibodies, or it has antibody activities in this area. And because of having plasma proteins, it helps to attach this free gingiva to the what? To the tooth surface. That is point number 3. Then, of course, lastly, it possesses what? And what? Microbial what? Properties. Those are the 4 functions of the gingival clavicula fluid. Cleansing materials in this area, antibody activities, improving adhesion to the tooth because of plasma proteins, and lastly, antimicrobial properties. Free gingiva is very important. That is one type of gingiva. We have another one. Called attached gingiva. Remember, attached gingiva, when we have this free gingiva up to here, where it ends, we call it free gingival groove. It is up to here. So from the free gingival groove, it is attached up to around here, where the alveolar mucosa starts. So attached gingiva, it is part of the gingiva which is held on the tooth, which is attached on the what? On the gum. So if this is, or this one is what? Attached gingiva. Attached gingiva. And this is what? Strip-on. So the next type of gingiva is what? It is strip-on. The next type of gingiva is interdental. Interdental means it is in between the what? The teeth. And of course, when you look at it, if we have this tooth and another tooth, so the gum, the one we are talking about, the free gingiva is, this one, this is now the what? The free gingiva. Rather, sorry, this is the interdental, in between one tooth and And number 2, between this and this is the what? Free gingiva. Sorry. Between this tooth and this tooth, this is the interdental gingiva. Interdental gingiva is the gingiva in between teeth. Then in this area, as I said before, this one is the attached what? Gingiva. Then the one which makes a corner of a tooth, this is the marginal gingiva, unattached, or what we call what? The free gingiva. Those are the 3 types of gum we have. Then lastly, we could talk about what the epithelium. Epithelium, we are saying the epithelium here is stratified squamous epithelium. It may be para, it may be ortho or non-keratinized, depending on the on the position of this gingiva in the oral cavity. When you talk about the cells of the oral cavity, we can have melanocytes present, Langhans present, mark cells, and lastly lymphocytes. We already talked about this, the importance of materials, importance of this gingival clavicula fluid, and this is the summary of the gingiva. Thank you so much for watching.